Hi, this is Robin Mears. I'm doing a presentation on my 90-year-old patient that came into the clinic this week with gradually increasing weakness and loss of gait over the last 2 months. He denies any injury or any pain in his lower extremities. He does report the weakness gets worse in the afternoon, but better in the morning. He reports that about a month ago he started using a walker because he noticed that his balance was declining. He also actually reports that about that same time he started to have some increased lumbar spine pain that ranges from 2 out of 10 to 6 out of 10. He says that, but when he's sitting, he says it doesn't really hurt at all. When he's up and about, the pain ranges from 2 to 6. Past medical history, he has hypertension and hyperlipidemia. Hasn't been in the hospital since he was about 28 when he had an appendectomy. No other surgeries or hospitalizations. He has no allergies. He denies any environmental food and drug allergies. His home medications are a men's multivitamin and losartan 50 milligrams. He takes a half a tablet twice a day, and atorvastatin 40 milligrams, 1 tablet at night. No significant family history. Social history, he lives alone. His daughter does live 3 doors down, and she checks on him at least twice a day. Chemically, he's never smoked. He does drink 1 to 2 alcoholic beverages a week, and he denies any illicit drugs, including marijuana. Review of systems reveals a 90-year-old male who denies fever and fatigue, but does report weakness, no reported weight loss or weight gain. Cardiovascularly, he denies orthopnea, shortness of breath at rest, chest pain and palpitations. He denies dizziness and syncope. Respiratory, he denies shortness of breath, production of cough, cough without production, wheezes, and shortness of breath at rest. Musculoskeletally, he denies myalgia, dorsalgia, injuries, joint replacements, and surgeries. Reports he does have arthritis of the right hip and the lumbar spine. Neurologically, he denies any syncope, dizziness, periods of confusion, numbness, or tingling. Objective, his heart rate 72, BP is 120/68, temperature is 98.4, room air sat is 99%, respiratory rate 17, pain is 0 to 6 out of 10, and his BMI is 22.5 with a height of 5'10" and a weight of 157 pounds. His neck is supple, no adenopathy, thyroid is smooth without any nodules or goiters, no heaves, lifts, thrills. Sorry, we've moved on to cardiovascular. No heaves, lifts, or thrills, and no bradycardia or tachycardia, S1, S2, no gallops, murmurs, or clicks. Respiratory, he's got symmetrical chest expansion with inspiration and expiration. No use of accessory muscles or pursed lips. His AP ratio is 1 to 2. No, he has bronchovesicular lung sounds on all lung fills, anterior and posterior. No rales, rhonchi, wheezes, or crackles heard. Musculoskeletal. He's got some cervical kyphosis and some lumbar lordosis. Palpitation reveals no masses, hematomas, or deformities other than those mentioned above. Range of motion, he's very stiff. Flexion is 60 degrees, hyperextension is 5 degrees, lateral flexion to the right and the left is 5 degrees, and rotation is 10 degrees to the right and left. He has a shuffling gait, but he does maintain his frame within, maintains his body within the frame of the walker, so he uses it very, very safely. But he was unable to stand for more than 3 to 5 seconds without holding on to the walker. So he's got quite a lot of balance deficit. So main diagnosis is going to be other malaise, R53.81, asthenia, debility, declining in functional status, deconditioning, malaise and fatigue, physical deconditioning, age-related physical debility, chronic debility, NOS, general physical deterioration, malaise, NOS, and nervous disability. And actually, I'm going to change that to just age-related physical debility, and it's R54. So I'm going to change that. So this is a gradual decline of a 90-year-old male reported over the last 2 months. Exam reveals decreased range of motion to the lumbar spine and bilateral lower extremity weakness. And on exam, I did find a little bit some neuropathy, bilateral lower extremities, and balance deficits. Differential diagnoses include looking at electrolyte imbalances, hypothyroidism, and anemia. So our plan is going to include a 2-view lumbar x-ray just to rule out any sort of trauma or orthopedic issues to that lumbar spine. And we're also going to get a CBC, a CMP, a TSH, T3, T4, and a vitamin B12. We're going to refer the patient for PT to evaluate and treat lumbar radiculopathy, bilateral lower extremity weaknesses, and balance deficits. We're going to educate the patient to use a walker to aid in balance until cleared by PT, and not to use any furniture as a substitute for the walker. No furniture surfing. And then remove the throw rugs and rolling chairs from the home to avoid a fall. Use the brakes when transferring to and from a wheelchair, and do not stand on a step stool or a ladder, and consider not driving until strength returns. Also consider wearing a wearable device that allows him to get help should he fall and not be able to get up. And I provided him with a pamphlet. And then no new medications. And I was going to follow up in 2 weeks for a lab review and an x-ray review, and then return to the clinic or call for any concerns. For any falls, he needs to go to the emergency room. And that's my case. I hope you guys have a good day. Bye-bye.